everyone, my name is Rebecca.
And I'm Tanya.
And we're from Home Health Homecare Agency.
And today we will discuss 7 tips on how to have patience with your patient. Home health aides help those who need assistance in their daily life routines. Dealing with difficult patients might be hard, but it doesn't have to stop you from doing your job. Every patient is unique and there are no universal strategies, but there are tips you can use to handle the difficult situations with different patients.
In order to be a successful home health aide, there are many useful skills and qualities you can learn to help deal with a difficult patient. Here are 7 tips that you can learn to help you deal with those difficult situations. The first tip is to not take anything personally.
Keep in mind that your patient might be suffering from unfortunate circumstances and can be moody. Don't let their mood swings affect your job. Just try to understand the situation they are in. Don't think that the patient is having personal grudges or is upset with you specifically. Tip 2. Look for the cause.
Many patients may present negative moods as they can be suffering from side effects of medications and pain, which can cause frustration. By looking at the underlying cause of the problem, you can change their mood. You should try to find out why a patient is being aggressive and moody rather than just reacting in a rash manner. The third tip is to show that you care.
Sometimes a patient thinks that no one cares or listens to them, so they might act aggressively and make an issue out of anything. Rather than getting irritated with the patient, deal with them in a caring manner. The fourth tip is to be attentive at all times.
While working in a home health environment, it is crucial to be attentive at all times. Your first priority is to give your patient the care that they need and make them feel comfortable. While doing so, don't get distracted by doing other tasks. As for some patients, they need extra care to help carry out their daily activities. So you need to keep a close eye on your patient as he might fall or injure himself. The fifth tip is to have great communication.
When it comes to working as a home health aide, communication is the most important skill. You should listen to everything your patient says to you. That includes them telling you about the side effects of medications, their symptoms, or if they want to share something personal. The sixth tip is to be flexible.
The most important skill a home health aide should have is flexibility. You should keep in mind that you're not only keeping track of a patient's physical health, but also their daily routine. These tasks might include bathing, feeding, dressing the patient, as well as doing other house chores. For this, you need to show flexibility and be open about any kind of tasks you may be asked to do during your shift. The seventh and final tip is to remember that empathy goes a really long way.
If you get frustrated or irritated with the patient's condition and are unsure on how to handle them, try to think about how you would feel if you were in your patient's shoes. Some days they might be quiet and not want to talk, and you should try to give them their space. Remember that your job is to care about not only the physical but the emotional well-being of your patient. Your patient might be dealing with more pain or emotional trauma than others, which can cause them to behave differently. Try to remain patient with your patient at all times and understand their unique situation.
Thank you so much for watching. Stay tuned for more videos.
And don't forget to follow us on all social media platforms.
Bye!